So next we'll hear from our first panel. They will discuss trends in sexual behavior and reproductive health. For each panel, we would like speakers to remain seated until after their presentation. For Q&A, we will have the entire panel at the table up front to take questions from the committee. We have one panelist who's joining us remotely, and I'll introduce them in a moment. For this panel, each panelist has 12 minutes to give remarks, and then we will have 25 minutes total for Q&A. I'll introduce all of our panelists now. Where is that? So Lynn Barclay is President and CEO of the American Sexual Health Association, and Lynn's going to speak first. Thank you.
Thank you. Thank you for inviting me, and really for what you're doing. Oh, and thank you for the work that you're doing. No pressure. It's only been done once before, and we didn't get too far. But I have great faith in you guys. Okay, so I wanted to start with disclosures. These are my disclosures. So ASHA was founded in 1914, and our role was to translate research to the public in a way that they could understand. So we've been doing it for a long time. Of course, it's always based on medically accurate information. And while we have focused on the public, we've also had other audiences, and we've talked about that today already. But, you know, policymakers, media, providers, etc. But our focus, as I say, has always been and probably will always be the public. Our means of communication, though, has changed over the years, as you can imagine. Oh, you changed it for me. Thank you. Somebody changed it. I didn't change it. I don't know how to go. Let me see. Anyway, our means of communications has changed from chat rooms to email services to text lines. But through all of that, we've had direct communication with the public, which has given us what we believe is a unique perspective on what is needed. And I'm sure no one will be surprised to hear me say that there is a pressing need for comprehensive sex ed. And I can give you an example. Our text line that we have right now that is directed at teens, where they can ask questions about pregnancy or STIs or other sexual health questions. There is a common question that comes up, of course, or some of the common questions are like, can I get an STI from oral sex? But there's also a surprising number of questions that are, can I get an STI from a toilet seat? Right? So you think, oh my goodness, those children are so young and naive. But we also have a service called Ask the Experts, which is really directed at adults, and there are a surprising number of questions that are really similar, if not the same, and include toilet seats. So really, we're not talking about just young people need to be educated, but really across the lifespan. I'm a Catholic schoolgirl. I had zero sex ed, right? So what happens if I had not come to ASHA, I'd never heard of chlamydia when I came to ASHA. Think about, I can't be the only one like that. And let's be clear, seniors are having sex, lots of it, but they're doing it unprotected. So then we go to our parent website, and I chuckled when Gail told us yesterday. I looked to see what are our top 10 search topics. 7 of the 10. Oh, by the way, we get about 6 million unique visitors to our main website, ASHA Sexual Health. Herpes. 7 out of 10. Now, why are they coming to us? Because of stigma, fear of talking to their provider or their parents if they're young, or their friends even. People are highly stigmatized, and the anonymity of some of our services are huge benefits to them. Of course, there's also people out there peddling really bad information and whatnot, you know, crazy fixes that have no way to do anything for us. There's also a new wave of technological innovations that are amazing, addressing barriers and improving sexual health, like home delivery of such things like contraception and PrEP services from NERCs and Pill Club, and of course Planned Parenthood has services. For the past several years, ASHA has been involved in a research study involving self-collection of HPV tests, right? And that's been very popular, and what we find is that people really can do it, appreciate it, and prefer it very often. I'm also on the board of Callisto, which is an app. They developed an app for sexual assault reporting. So these are some of the ways in which technology is helping all of us. But there's problems too. There's something called Me Too Kit, if you've not heard about it. There's a company selling what they call the Me Too Kit, which is supposed to take back control for sexual assault survivors. So they buy a kit, they take their own swabs, but it's not admissible in court. So what exactly are we telling these people? So we have to also watch technology. It can't always be the answer. And in fact, their website says there is no guarantee that any of the evidence collected as a result of the use of this product will be admissible in court. So what have we done? I hope you'll agree what we really need is a broader cultural shift. We need to move away from disease and stigma and move towards positive messages that are sex positive and wellness based. When ASHA develops messages, what we try to really focus on is an emphasis on wellness, focus on positive, respectful relationships, because I could go on a lot about that, but I don't have time. Acknowledgement of the impact of sexual health on overall health, right? And an integrated approach to prevention. Our ultimate goal is to normalize sexual health as a component of overall health. A few examples of some projects that we work on right now. One is the National Cervical Cancer Coalition. These are volunteers around the country who educate people in their communities about HPV disease, and specifically cervical cancer. But they educate, I don't even know how many people in their communities, and have all kinds of impact. Another one we have, that's slide. That's this one. That's the sexual affirmer. Okay, another one we have is our ambassador program. We recruit volunteers around the country and around the world to take positive sexual health messages from us and or develop them. So we give them one message, they send it to their network, and so we have 517 ambassadors right now, but those 517 reach 830,000 approximately. So think about that for each message. So another campaign we have is called Yes Means Test. This is a campaign directed at 18 to 24-year-old young women, specifically around testing around chlamydia and gonorrhea. I don't have time to show the video. Maria was asking me if I was going to do that. There's not enough time for any of us to do nearly as much as we'd like to be able to say. But what we try to do is not just educate young women, but the action that we're trying to achieve is move them to the clinic locator. And that's the measure in that case, other than reach and engagement and all of the things that you expect. And one of the ways that we've done that is that we use what are called social media influencers. I'm sure you've all heard of them or know about them. The point is for these people to meet the audience where they are. And they deliver their messages from an aspiring young person to aspiring young women. So it's people talking to the people that they can relate to. While we give them the content we want them to talk about, they translate it into the way that makes sense in their own style, so that it stays authentic. One of our influencers, Dulce Candy, who is a vlogger who primarily focuses on beauty and home decor, shared her personal story of being diagnosed with chlamydia, as well as having an abnormal pap, and generated an overwhelmingly positive response from viewers. Additionally, those who went to Yes Means Test, the website associated with this campaign, who came from the YouTube from Dulce Candy, generated the highest percentage of clinic searches. Now, we can't say a clinic search results in a test, but you can say it appears there's intent. Yes Means Test reflects the benefits of the sexual health framework. Discussions of sexual health and STIs naturally woven into the conversation along topics of beauty and home and nutrition. So we've come really far. Okay, so this is the action engagement awareness. You can see more than 8 million hero videos. We have a lot of videos associated with all of this. All right, 26,000 clicks on website clinic locator. I apparently don't do this part very well. All right, so I think you can see that. So we've come really far, but we still have a really far way to go. I'll let you read that. So our goal is to get everybody to be Graciela. They recognize the benefits, and they are willing to challenge those who push back and stay uninformed. And lastly, we have one new campaign, or another new campaign that we're doing, and that's directed at young military. There are 4 primary messages. I have no results yet because we just launched it last week. But that's testing, contraception, PrEP, and HPV vaccine. And we hope to be doing more with them. So thank you so much.
Thank you, Ms. Barclay. And by the way, we would be happy to see the video. You can send us the link and we'll all watch it, but not now.
Perfect.
Appreciate it. Thanks. And we'll call you back after the other 2 speakers.